Welcome to Sam the Stoic. Today, we're diving into a crucial topic for all of you studying nursing, hypovolemic shock. This is one of those things you need to understand deeply, not just to pass exams, but to save lives. So, stick around, hit that like button, subscribe to the channel. And don't forget to share this video with anyone who could use a little extra help understanding this topic. If you have any questions or thoughts, leave a comment below. Let's learn together. Alright, let's talk about hypovolemic shock. Sounds intense, right? But don't worry, I'm here to walk you through it step by step. By the end of this, you'll not only understand what hypovolemic shock is, but you'll feel confident explaining it to others. Hypovolemic shock happens when the body loses too much blood or fluids, leading to a dangerous drop in circulating volume. Imagine you're trying to water a garden with a hose that's almost empty. There's just not enough pressure to get the water where it needs to go. In the body, this means organs and tissues aren't getting the oxygen they need, and without quick intervention, this can lead to multi-organ failure and even death. Now, before we dive into the details of hypovolemic shock, let's take a second to understand shock in general. Shock is when the circulatory system can't deliver enough oxygen to the body's tissues. There are four main types of shock, based on what causes that failure. 1. Hypovolemic shock, which means there's not enough blood or fluid in the system. 2. Cardiogenic shock, which is when the heart's pump isn't working properly. 3. Obstructive shock, this is caused by something physically blocking blood flow. 4. Distributive shock, when the blood vessels become too wide and lose their tone, like in sepsis or anaphylaxis. Here's a quick question for you. Can you name all four types of shock and what causes each one? Pause and think about it if you need to. Now, let's focus on hypovolemic shock. The key feature of hypovolemic shock is the loss of at least 15% of blood or fluids. When that happens, the body basically goes into crisis mode. It's like your body's internal alarm system gets triggered, and it says, okay, we're low on volume, let's compensate. Your sympathetic nervous system, which is the part of your nervous system responsible for the fight or flight response, kicks in. Your heart starts beating faster, your blood vessels tighten up, and the body works hard to keep blood flowing to your most important organs, the brain and the heart. But if the blood loss keeps going, the body can't keep up. Blood pressure drops, tissues start running out of oxygen, and cells switch to anaerobic metabolism, which means they're trying to create energy without oxygen. Unfortunately, this produces lactic acid, which makes the blood more acidic. Too much lactic acid? Things start to get really bad. Pop quiz. What happens when the body switches to anaerobic metabolism? Remember, lactic acid builds up, and that's a big red flag. Now let's talk about the symptoms of hypovolemic shock. In the early stages, it might be subtle, pale skin, maybe some mild anxiety, kind of like someone waiting for test results. But as it progresses, things get more obvious. The heart rate speeds up, breathing gets faster, and the person starts to feel cold and clammy. Their skin may become pale or even bluish, which is a sign of cyanosis, that bluish tint that means the body's not getting enough oxygen. If the brain isn't getting enough blood, they can become confused, agitated, or even lethargic. In severe cases, they may pass out entirely. Here's a question for you. What's the hallmark skin symptom in advanced hypovolemic shock? Hint, it's cold and clammy. Alright, time for some story time. There are two main categories of hypovolemic shock. 1. Hemorrhagic shock. This happens when you lose blood. Think trauma from an accident, a GI bleed, or postpartum hemorrhage. 2. Non-hemorrhagic shock. This happens when you lose fluids instead of blood. This can be caused by severe vomiting, diarrhea, burns, or fluid shifts from conditions like pancreatitis. So here's a fun challenge. Can you name some common causes of hemorrhagic and non-hemorrhagic hypovolemic shock? Take a second to list a few in your head. Now, how do we know how bad it is? Hypovolemic shock has 4 stages. In stage 1, which is mild, the person has lost less than 750 milliliters of blood. They might look a little pale and anxious, but otherwise, they're okay. In stage 2, moderate, they've lost up to 1,500 milliliters of blood. Their heart rate speeds up, and you'll see delayed capillary refill, which is when you press on their skin and it takes longer than normal to turn pink. Again. Stage 3, severe, means up to 2,000 milliliters is gone. Blood pressure drops, they're breathing over 30 times a minute, and they're agitated and confused. Stage 4, critical, is when they've lost more than 2 liters of blood. Their pulse is weak, blood pressure is dangerously low, and they're in and out of consciousness. Real talk, if someone's in stage 4, every second counts. So, how do we manage hypovolemic shock? First, you need to stop the cause. If they're bleeding, apply direct pressure or use a tourniquet if necessary. If they're losing fluids from vomiting or diarrhea, give antiemetics and fluids to replace what they've lost. Next up, fluid resuscitation. Time to refill the tank. We usually start with IV crystalloids, like normal saline or lactated ringers. But if it's hemorrhagic shock, you'll likely need blood products, things like packed red blood cells, PRBCs for short, plasma, and platelets to help restore their blood's oxygen-carrying capacity. Fun fact, a standard emergency fluid bolus is 500 milliliters over 15 minutes. That's fast, but it can be life-saving. Now, while you're doing all this, you need to keep a close eye on their vitals. Watch their heart rate, blood pressure, and urine output. Aim for at least 0.5 milliliters per kilogram per hour of urine output. That's your sign that the kidneys are still working. And remember, always assess your patient as a whole. Don't just rely on one reading, look at their skin, their breathing, their mental status, everything. Let's do a quick recap. What's the difference between hemorrhagic and non-hemorrhagic shock? What's the hallmark symptom of stage 3 hypovolemic shock? Why is urine output so important when monitoring a patient? If you found this video helpful, hit like, subscribe to Sam the Stoic, and share it with anyone who's working their way through nursing school. And if you have questions or want to practice explaining this topic, drop a comment below. Thanks for watching, keep learning, and I'll see you next time.